Welcome to Epic Begins with One Step Forward. I'm your host, Zander Sprague, and I am so delighted that you've joined me today. I've got an exciting show. I wanted to start off with the thought of the day, and it's what I call the pizza analogy. When we're faced with doing our epic project, our epic journey, it seems overwhelming. But if you think of it like a pizza, it's actually a lot easier. Because when you eat a pizza, you don't roll the whole pizza up and eat it all at once. You eat it one slice at a time. And by and large, that's fine. The only exception, of course, is if there happens to be a teenage boy there, then you gotta eat quick. But as you're on your epic journey, we think of the slices of pizza. While you're eating the first piece, you're not worried about the third piece of pizza. You're just focused on what you're doing. And that's how you can plan and structure your epic journey, is by saying, here's what I'm dealing with now. Here's this first step I'm doing. And then I'll move on to the second step and the third step, etc. There is that old saying that how do you eat an elephant? One bite at a time. Well, this is similar, but I don't know about you. I'm not eating any elephants anytime soon. So I like pizza, and so I like the pizza analogy. I want you to incorporate that into what you're doing. That way, when you're eating pizza, you'll think about your epic journey. Today, I am joined by Dr. Maggie Burton, who is an eye doctor. I'm not quite sure exactly what your designation, but tell us who you are and what you do.
Awesome. Thank you so much for having me. I'm really excited to be here. We were talking earlier and I was saying I could talk about eyes all day, so I think we'll have a nice conversation. But like Zander said, my name is Maggie Burton and I am an optometrist. What that means is I did my 4 years of undergraduate, 4 years of optometry school, an extra year of residency focusing on ocular disease. I work at a private practice called Bogosian Vision where I provide eye care. I think most people think of going to the eye doctor, getting their new glasses, contact prescription updated. But we also provide comprehensive eye care, diabetic eye exams, screen for eye conditions, treat eye conditions. So it's a lot more than just your basic glasses exam.
Absolutely. So how did you choose to go into ophthalmology?
So I knew that I wanted to work in the medical field somewhere, but like many people, there's a lot of different areas that you can go into, and I had worn glasses and contacts my whole life, so that gave me a little bit of exposure.
Sure.
And so when I was in college, I did some job shadowing in different professions, and I just absolutely fell in love with eye care. What's better than helping people see better? I mean, that's just so fun. Every day is really different. I see kids age 5 and older, so I might have a 5-year-old and then a 98-year-old next. And so every day is really fun. You never know what's going to come into the door next. And so it just is a great, great job.
Great. And so I guess my question is, when you were in school, were you a good pupil?
I would say I was. I might be biased, but I think I was a good student. I took it very seriously because I knew people were trusting me with the health of their eyes. And so I really worked hard in school. I graduated at the top of my class, and I've just stayed involved after that as well. So.
Absolutely. So what are one or two of the top eye issues that people should be aware of, sort of understand symptoms, signs of that are treatable, and we should be on the lookout for?
Yeah. One that is definitely concerning is the myopia epidemic. So In the 1970s, about 1 in 4 people were nearsighted. Now it's closer to 1 in 2. And a lot of that has to do with the environment that we live in now, the extra screen time, not spending as much time outdoors. Our lives are a lot different than they were back then. And so we see kids especially are becoming nearsighted at younger ages and at faster rates, especially after the pandemic and spending more time in class at home and on the screen. That's really rapidly progressed. And so it's more than just having to wear glasses. Myopia is nearsighted vision, but that is actually a risk factor for cataracts, glaucoma, blindness from retinal detachments. And so it's important to kind of stay on top of that. Yeah.
Yeah, no doubt.
Yeah.
So here's something I've always wondered.
Yeah.
I'm nearsighted, but it means I can't see far away. So do you have any history of why we call it nearsighted versus farsighted?
Yeah.
You know, I mean, it seems nearsighted go, oh, I can't see things near, but that's the opposite.
It's very, very confusing. I deal with this confusion every day from people, but nearsighted means that you can see things near, up close. Things long distance are blurry. Farsighted is the opposite. Things far away are more clear. Things up close are more blurry. I don't know the etymology of those terms, but that's kind of the definitions.
Okay. And so, you know, interesting. The more screen time we have, do you know of any research that says the reason we have more myopia is it just because we're focused more in a shorter distance and not utilizing those muscles or eye muscles to see farther away? Yeah,
that's exactly it. We know obviously genetics plays a role in everything. So if you have one parent that's nearsighted, you're twice as likely to be nearsighted. If you have 2, you're 5 times more likely to be nearsighted. But your brain is smart, it adapts to your environment. If your environment is only this distance and not far away, your brain assumes this is the most important distance, and so you become more nearsighted, basically. It's actually just adapting to try to help you, but in this case, it's obviously not helpful.
Definitely. And I'll do a little self-disclosure here. I've got probably a somewhat unique eye condition in the fact that my left eye, although very healthy and probably has better sight than my right eye, the signals going back to the brain are just never fully formed. I was lucky because being a child of the 70s, I had a ophthalmologist who recognized that something was wrong when I was about 5 or 6. And I went in and had treatment. I wore a patch for a year to strengthen my left eye, and that probably saved a lot of my vision. But what are some of the causes of that? Is it just sort of idiopathic, kind of, where we don't really know, or?
So it's called amblyopia. There's many different causes, but all of them boil down to basically, for some reason, one eye is not getting input from a young age. When you're born, you actually don't see very well. You need that input from the world and that vision to come in to kind of strengthen that pathway between your eye and your brain. And so there's some causes, like in your case, if one eye is not facing completely straight, then instead of seeing 2 images, your brain will kind of turn off one eye. And so because of that, you don't get that nice vision input going back to the brain. For some, it could just be that you have very different prescriptions between the 2 eyes. So one eye has a much higher prescription than the other. Same thing, you're not getting that clear image that's required to strengthen and develop that pathway to the brain. Some kids are actually born with cataracts, and so that could be a cause. There's many different causes, but luckily with early treatment, so if it's diagnosed before age 7 is kind of that critical period, with getting glasses, with wearing an eye patch for a couple hours a day, often we can kind of strengthen that weaker eye.
Absolutely. And so there's obviously that sort of emphasizes how important starting eye exams is at no older than 5. It'd be better probably before, because if something's wrong, the younger you are, the better chance because of all the development that's going on.
Absolutely.
Correct?
Yeah, it's super important for kids to get a comprehensive eye exam. The screening at the pediatrician is great, but it's not testing everything that we're testing at that first eye exam. We're checking the vision, we're checking for prescription, checking the eye alignment, checking how well the eyes are working together as a team, color vision, health of the eye, development of all of those structures. And so obviously anything caught early can be addressed. Unfortunately, if it's caught later, it's much harder to treat.
Definitely. And being that I'm older, I every time I come in and ask you, like, is there some cure for my amblyopia? Is there something that they've come up with? And there's a lot of research that's going into amblyopia.
Absolutely.
And there is some treatments, but sadly, I think my wiring is done getting fixed. But like, what are some of the advances that have happened that you're aware of?
Yeah. So obviously we have the mainstay treatment, which is basically covering the good eye temporarily between 2 to 6 hours a day so that that weaker eye has time to develop normally. Some kids just are not going to wear a eye patch. We're talking about young kids. Some of them have developmental issues. They're just not going to wear that eye patch. So there's also an eye drop that can be used and just dosed on the weekend. You put the drop in Saturday and Sunday. It's basically like a strong dilating eye drop. You put that in the good eye and it basically acts as the patch. And so that takes a lot of the burden off of the kid and the parent to really comply with that treatment. There's also now amazing computer games and programs that make it seem much more fun than wearing an eye patch. And they're designed where you can wear special glasses, keep both eyes open. It feels much more comfortable for the child, and it feels more like a game and something that they're enjoying to do instead of, you know, being forced to wear an eye patch. And then for adults, again, it's a little bit harder, but there are still treatments that are being developed, different eye programs online and on the computer that have been shown to improve the vision a modest amount, but you know, enough to make a difference. So.
Cool. Now, two things that are very common, we hear all the time, but people might not necessarily understand all of the, like, what it is. Cataracts and glaucoma. What is the difference between them? What are they, and what signs should we be looking for?
Awesome. Yeah, those two conditions are things I see every day. And so I sometimes take for granted that people might not know what they are, of course. And people get those two terms confused all the time. So I'm glad that you asked about that. So I'll start with cataracts because that's the most common. That is a clouding of the natural lens in your eye. So your eye gets focused, all the light comes through the cornea, the front layer, and then through the lens, and that all gets focused to the back of your eye. Over time, with age, UV exposure, that lens just becomes cloudy. That happens to 100% of people. So there's no avoiding cataracts. When that starts, when that develops, has to do with genetics, your eye health. People with diabetes often will get cataracts at a younger age. So there's different factors, but ultimately everyone develops cataracts. Exactly. And so when that lens gets cloudy in the beginning, won't really bother you. It could maybe cause some extra glare when you're driving at night, but it's not going to significantly impact your life. Obviously, if it gets cloudy to the point where it's blocking light coming into your eye, things will look blurry, it's harder to see in dim lighting, and that's where we start to talk about cataract surgery. That's where they remove the cloudy lens and actually replace it with an artificial lens. People nowadays, it's funny, they actually kind of look forward to cataract surgery. I know that sounds strange, but when they put in that new artificial lens, they actually can put prescription into that lens. And
so all of a sudden you don't need glasses anymore. And that's kind of cool.
Exactly. So it's much more advanced now, and the lenses, they're coming out with new lenses every year that are better and better. And some of them can even correct distance and reading, so you don't even need reading glasses after cataract surgery. The surgery itself is very safe and effective, and so that's something, you know, everyone goes through, but the treatment options are always improving.
Definitely. Now what about glaucoma?
Yes, glaucoma is a little bit scarier. Not everyone develops glaucoma. Glaucoma, about 4 to 5 million people in America have a diagnosis of glaucoma. And the scary thing about glaucoma is that it actually doesn't cause any symptoms in the early stages. It's not until it's pretty advanced where you'll actually notice a change in your vision.
Right.
And so what glaucoma is damage to the optic nerve. That's the part of the eye that brings all the information from your eye to your brain. Typically, it's caused by high eye pressure. So basically the pressure in the eye, your eye makes a fluid, it starts to push on the optic nerve and slowly causes damage over time. The main symptoms, it'll affect your peripheral vision first, but if you're noticing that, it's unfortunately, there's already quite a bit of damage there. So that just highlights the importance of getting your annual eye exam. Your eye pressure will always be checked. Your optic nerve will always be evaluated at every visit, because if it's caught early, the nice thing about glaucoma is it's very treatable. It progresses very slowly. So there's time to intervene before it actually causes any damage to the vision.
And is there any connection between retinal detachment and glaucoma?
So actually those two conditions are pretty separate.
Okay.
Glaucoma and retinal detachment, what they have in common is myopia. Nearsightedness is actually a risk factor for both. But otherwise, retinal detachment is when the retina, the back layer of the eye, detaches. It can happen due to a tear in the retina. It can happen due to diabetes. There's lots of different underlying causes. Most of the time, it's just people that kind of get unlucky when the gel of the eye pulls away from the retina. It can cause a tear, which can lead to the detachment. It's funny you bring that up. Actually, my own mom just had a retinal detachment last week, and luckily she has me to kind of talk her through it. But those symptoms to look out for retinal detachment, because usually they will come with symptoms, unlike glaucoma. Any new floaters in your vision, flashes of light in your peripheral vision, or any kind of curtain or shadow in your peripheral vision, all of those you have to go get your eyes checked right away.
Definitely.
And if you say those symptoms, your eye doctor will get you in that day for sure.
Absolutely. So maybe this is a old wives' tale kind of myth or whatever. Can you do eye damage if you sneeze, but you're trying not to sneeze out, so you hold in the sneeze? Because sneezes have a lot of pressure, and if you hold it in, could you detach your retina that way?
So I've never seen a retinal detachment that way, but definitely it can cause some issues. It can cause a buildup of pressure, like you mentioned. So some people will actually pop some of the blood vessels in the front of the eye or even in the back of the eye by doing that. Typically, that's not going to cause long-term damage, though, but I wouldn't worry too much about it.
Right. Okay, so I want to jump back because it just came into my with cataract surgery.
Yeah.
The new lens, can they correct for astigmatism?
Oh yeah, absolutely.
Okay, cool.
Yeah, they can pretty much correct any prescription with those newer lenses. So I mean, it's really advanced significantly.
Definitely. When I was younger, started wearing contacts. They were great. Contacts have come a long way.
Oh yeah.
I was a teenager. I had horrible, I don't want to say eye infection, but I was having issues. I believe they call them papillary conjunctivitis or something. And so I could only wear my contacts for so long. I had to clean them all the time. Now we have daily wear lenses, which I think are a lot healthier for our eyes.
Absolutely.
And do you have any particular feelings about the 30-day lenses?
Yeah, I mean, I always first line recommend a daily disposable lens. Obviously, you're using a fresh lens every day. Very rare to see an eye infection with the daily disposable lenses because any bacteria on the lens is getting thrown away with that lens at the end of the day. Obviously, those are more expensive. So unfortunately for some people, cost-wise, it's just not an option for them. So there are 30-day lenses that are safer than some of the older generation lenses. They allow a lot of oxygen into the eye, which helps to reduce the risk of infection. as long as you're cleaning them and taking care of them properly, then the risk of infection is still very low. Really, infections most of the time are when people are not doing what they're supposed to. So they're sleeping in their lenses, they're not cleaning them with the right solution, they're not using fresh solution every time they clean the lenses.
Right.
So typically the 30-day lenses are still a safe option as long as you're using them properly. But again, I always recommend a daily
And you're supposed to be
disposal.
taking them out every night.
Yes.
Okay.
Yes.
Not, oh, I wear this for 30 days and then.
Yes, there are some that are approved for that. That's very, very rare. There are maybe some circumstances
Sure.
where we would consider that, but generally take them out every night.
Okay, cool. Our eyes are obviously so very important.
Yeah.
And, you know, I'm sure some people have sort of a little fear around, well, I don't want to know if something's wrong. I sense something is wrong, but what education can you give the audience just about, I mean, I hate thinking about losing vision.
Yeah.
And I love seeing.
Yeah. Yeah.
So, but I get that there's sometimes we're just scared because we think something's wrong. We don't know. So how do you help your patients who might have some fear, or people who are watching and they're like, I don't know. I don't like doctors. I don't know if I want to know.
Yeah. I think that's a very human, real fear that a lot of people face across the medical field, not just with eyes. But I think I read somewhere that losing vision is one of the top 3 fears. And I completely understand that. I mean, it's so important, and we use our vision all the time, every day. You know, it's so important. So I would definitely make sure to encourage people and remind them that many of these conditions that we've talked about, glaucoma, cataracts, macular degeneration, there's time to intervene before it actually gets to a point where it's affecting your vision. Time is on our side. Early diagnosis is super important. And so just going in for that eye exam, it doesn't mean that you're going to get the news that you're going blind tomorrow.
Yeah,
you know,
exactly.
There's time to treat it. The treatments are really easy. For glaucoma, for example, the first line treatment is just an eye drop at night, before you go to bed, just 1 drop a day. So it's not like you're getting rushed into surgery or anything of that nature. The treatments are really effective and work really well. So getting that diagnosis doesn't mean that you're going blind. It just means that you have to do the proper management.
Absolutely. Absolutely. And I mean, it's amazing. I've got my contacts in now, but I do wear glasses. And I have to say, I'm amazed at, again, the advancements in how thin the lens is, how light lenses and frames are now.
Yeah.
So even if you have a really heavy prescription, you can get it, and people won't necessarily know that.
Yeah, every prescription is available in contacts now. Even if it's not the standard off-the-shelf contacts, there's specialty contacts that are available that cover every single prescription. So anyone who wants contacts can certainly be fit into contacts.
Okay, so I'm gonna say the daily wear lenses I have are, I don't know that they're correcting the astigmatism as much, but maybe I'm wrong. I mean, I know they do have them, but...
Yes, yeah, your lenses do correct your astigmatism. You have a higher level of astigmatism, so they correct most of it, though.
Yeah.
And the parameters are always expanding.
Absolutely, absolutely. What are some, in watching the news, we see all kinds of ads for drugs.
Yes.
And I love when they come on, because they don't really ever explain. They've only got 30 seconds, so they don't explain what it is. If you've got wet AMD, but I see that ad all the time. I think, oh, well, this is great. What is wet AMD?
Yeah, so age-related macular degeneration, AMD. There's different types. There's the dry macular degeneration and wet macular degeneration, and they basically have those names because the wet macular degeneration means that there's actually fluid leaking into the back of your eye. That's why it's wet.
Yeah.
Dry, there's no fluid leaking into the back of the eye. Macular degeneration is a degeneration of the macula, which is the part of your eye that's responsible for your central vision. And so the wet form, basically when there's that fluid leakage, they actually treat it by injecting medication into the eye. So that's the ads that you're seeing.
Yeah.
And that actually helps that fluid get reabsorbed and maintain really good clear vision. Those treatments are extremely effective.
That's great. That's great to know. Are you aware of any, I'll call it bionic eyes? So someone who may be vision impaired or mostly vision impaired.
Yeah.
I mean, because I know that with hearing, I had a guest on who does cochlear implants. So if you're deaf, you can have a cochlear implant. It will go in, and now you can hear. Is the same thing happening for eyes yet?
We're not quite there yet, but it's always getting closer. Research is getting better. I think especially with the new gene therapies available, there's treatments that are helping to kind of repair the retina, but unfortunately the eye is just such a perfect design, it's hard to replicate.
Absolutely.
And so because of that, we're not quite there yet, but I think in the future that's a possibility.
Definitely. Well, I will hope for people, because I think it's amazing what we can do, and the technology that is being invented. We're getting close to the end of our time, but I wanted to know, is there a particular website or place that if people want to learn more?
Yeah.
Do you have like a website that you're like, this has good information? Because obviously on the internet, we can do a search, we can get something popping up, and maybe that information isn't as accurate as it should be. Yeah,
that's so true. I think nowadays there's too much information out there. So definitely some good resources. We were talking about myopia, kids' vision. There's a website called mykidsvision.org that has great resources. There's actually treatment options to slow down the change in that nearsightedness, and it kind of outlines all of those. Then also the American Optometric Association website and American Ophthalmic Association, they have basically a page where they have all the common eye conditions. And so if you go there, you can look up what condition you have and get some more information.
Definitely. Well, thank you so much for that. It's always good to know the right websites to go look at, because I know I've pulled up stuff and I'm like, is that accurate?
Yeah.
I don't know. I tend to go for, well, if it's Mayo Clinic, it probably is right. You know,
and you're probably right there, yeah.
You know, New England Eye Clinic.
Yes.
Okay, that's probably also a reputable place to go. So we've been talking with Dr. Maggie Burton, and such great information all about eyes. Maggie, let me just say personally, is a superior peeper keeper. She's keeping my eyes nice and healthy. She's always so willing to answer questions, and that is great, because knowledge is power. I want to thank you so much for joining me here on Epic Begins with One Step Forward.
I really appreciate you having me on and talking about my favorite subject. And I always smile when I see you on my schedule, so I'm really happy to have you come in.
Thank you so much. I've got an epic update for you. Matt O'Neill, who was on my podcast a couple of months ago, has come out with this book about the formula for happiness. And I've read his book. It is so fantastic. And what Matt is doing is very, very similar to what I've been doing, talking about the epic journeys and the importance of happiness and finding the happy in what you're doing. It's not always easy. Sometimes the journey we're on is challenging. But every day, there are things that we can find to be happy about. And Matt's book really helps you understand where you can find that and how you can apply that to your everyday. So I encourage you to look up Matt O'Neill's book. It is so good. And I want to remind everyone that epic choices lead to the epic life that you want. You can go and begin your epic journey at epicbegins.com. You can email me at zander@epicbegins.com. I want to thank you for joining me today, and go out and be epic.